Today we'll be talking about, first and foremost, good evening, good afternoon, good morning. As you guys already know, I'm Dr. Ectopic. I come live, make sure that I bridge the knowledge gap or the ignorance or lack of information gap. Talking today on ectopic pregnancies. Ectopic pregnancy is pregnancy outside the uterus. There are so many locations where ectopic pregnancies could occur, and we're going to be discussing that. What are the things that could predispose or should make us prone to ectopic pregnancy? What are some of the symptoms? How is it managed? So we're going to be discussing all that today. Please share to your friends. You don't want to be told. It's going to be packed full of information. It means that the person is pregnant, yes. The tests show that the person is pregnant. The egg has been fertilized. But this pregnancy is now outside the normal uterine lining where it's supposed to be. So, I have explained the process of fertilization before. Every month, the woman drops 1 or 2 eggs. If she meets with her partner or a man, the egg gets fertilized. Where does it get fertilized? The egg is released from the ovary. Every month, egg is released from the ovary. The egg travels along the fallopian tube, and the sperm also travels up from outside. The man deposits it close up the cervix and meets the egg here in the fallopian tube. When the egg is fertilized, that is, sperm and egg have come together, the egg will go down back into the uterus and embed itself in this wall. And for the period of 40 weeks, the baby keeps getting bigger till you have the baby. We mentioned that in pregnancy, and eventually the baby is born. But for ectopic pregnancy, for so many reasons, I'll give you the reasons later. The egg is produced by the ovary. This is the ovary here. It's released and it gets to the fallopian tube. The sperm from the man goes up, swims up into the tube and meets with it and fertilizes the egg. But the egg doesn't go back into the uterus. It stays in the tube at the entrance. It may even come here and position itself. That is because the tube is not working the way it should. The muscles have been relaxed, so it's not moving the way it should. There are some tiny hair cells in the tube that make sure that this fertilized egg is moved back to the uterus. But for so many reasons I will be mentioning, the egg is not pushed back into the uterus, so the egg stays there. And because this space is small, number one, it will give pain. It can cause rupturing, that is, this tube can burst. It can cause bleeding. It can cause so many things, which may even lead to surgery if it's not handled on time, emergency surgeries, and it could lead to loss of life. Fertilized egg, when it gets implanted anywhere outside the lining of the body of the uterus, we call it an ectopic pregnancy. So this person will do tests. Remember when I was talking about the pregnancy journey, I said, look, when you are preparing for pregnancy, you want to know if you are pregnant, you go and do pregnancy tests. This person will do pregnancy tests to show that it's positive. Yes, you are pregnant. Congratulations. The next thing is, we now do a scan and check. I'm like, I can't find the pregnancy. But pregnancy test, the blood shows, or the urine test shows that you are pregnant. And looking around, the uterus is not there, it's in the cervix, is not there. Checking the tubes, we now find it somewhere outside. So there are different locations that an ectopic pregnancy can sit. If you look at this diagram, everyone, the most common site for an ectopic pregnancy, that is a pregnancy outside the uterus, is the fallopian tube. What is the fallopian tube? The fallopian tube is that tube that connects the uterus to the ovary. Abdominal pregnancies, as you can see, is about 1%. Pregnancy at just the opening is about 1%. Pregnancy that goes back into the uterus and now goes to an implant in the cervix is another 1%. But when you talk about the pregnancy in the fallopian tube, 70%, depending on the location, the ampulla, the isthmus, the fimbria. Here you have abdominal pregnancy. This pregnancy has fertilized in the fallopian tube. It has met with the sperm. The zygote or the embryo now goes all the way back into the uterus and goes deep into the muscle. Pregnancy is supposed to find itself in the lining, just in the lining, embed itself in the lining, not into the muscle. Some pregnancies even go far as going above the uterus, where the intestines are, and situating itself there. Some pregnancies stop at the entrance of the fallopian tube. Some pregnancies occur along this tube. Most of them occur here. Some of them even go the opposite direction and go to and embed in the ovary. It will damage the ovary. It would cause severe pain. It will cause bleeding. And the sad thing and the annoying thing about ectopic pregnancy is that it can recur. It not just happen once. So we are quite concerned because it's an emergency. So we notice that most of the time when a woman is pregnancy positive and she has pain, a high percentage of the time it's an ectopic pregnancy, that is a pregnancy outside the normal lining of the uterus. And because I've had several experiences and doctors have had several experiences of emergencies, people don't know, just miss their period. They don't do pregnancy tests, and by the time they discover there's pain, the complication has already occurred. That is the fallopian tube, because it's small and very narrow and very sensitive. It bursts into the abdomen, blood everywhere, placenta everywhere. Because it's ectopic, it's outside the uterus, it cannot progress. That pregnancy cannot progress very well. It cannot grow to the size it's supposed to grow. Most of the time, it should not even be allowed to grow. So it has to be removed. What are the symptoms? How do you know, or how do you suspect that you have an ectopic pregnancy? Features of positive pregnancy are there. Your period has stopped. You may have nausea and vomiting like normal pregnancy. Feeling of weakness like normal pregnancy. Person will be pregnant, truly pregnant. That is, you do a blood test, either your urine test, your blood test. It will show, oh, madam, congratulations. Your urine test shows that you are pregnant. When you start thinking, oh, there could be a problem. When you start having light vaginal bleeding, that is, you have stopped your menses. You have done pregnancy tests and it's positive. So then you notice quite early that there's vaginal bleeding. Maybe as a result of leaking from the fallopian tube. Remember I told you that this tube is not so thick, unlike the walls of the uterus. There may be bleeding because or causing an injury to the walls of the fallopian tube. It's no more as elastic and it's not causing you pain. So there will be pain usually on that side. Remember, you have two fallopian tubes. The nerves are being irritated, so this person will be feeling that pain with time. If it's not attended to, this egg continues like this. It can burst open. Emergency surgeries will have to be done. I'm talking once you diagnose straight to the theater, because you don't want the person to bleed to death, have a bleeding on the inside and internal bleeding. You don't want this person to have other organs damaged as a result of this pregnancy. So anytime we have severe abdominal pain, vaginal bleeding, and the person is confirmed pregnant, our first thought is ectopic pregnancy. What are the causes of ectopic pregnancy? Because I want to know what will make my egg stay in the fallopian tube after being fertilized and not go back into the uterus. Number one, inflammation or infection. When this person has an infection, for instance, pelvic inflammatory disease, PID, what it does is that it loosens the integrity of the tube. This tube, as it is, has some tiny cells that allow movement or pushing the egg back to the uterus. But if the person has inflammation, these cells are damaged. If the person has infection will cause inflammation and damage these cells. This wall, the smooth muscles that line the wall, will become weak and inelastic. So the egg is not encouraged to go back. In fact, that's why it goes in the opposite direction and sometimes can go into the uterus. Sexually transmitted diseases, for instance, gonorrhea, chlamydia, they could cause the damage of the epithelium, that is the lining, the cell lining of the fallopian tubes, then cause the egg to stay. The sperm meets it, it just stays there, it doesn't flow, it doesn't push it back to the uterus. That is why we said if you're trying to get pregnant, go check, screen yourself for infections. Sexually transmitted infections, urinary tract infections can cause the tubes to be weak and then cause ectopic pregnancy. With the use of fertility treatments, so drugs that actually help you to be more fertile. Remember that these fertility drugs act as triggers to allow you to get pregnant. And when there are extra hormones in your body, cells in the uterus, cells in the fallopian tube change. The fallopian tube smooth muscles again have prostaglandins running through them, have hormones running through them that determine the texture and everything. So when you take these medications, they soften up the lining of the fallopian tube. And of course, when the lining is soft, it will not easily allow the egg to push back to the uterus. People that want to do IVF too, that is in vitro fertilization, people that say, okay, look, I want to collect my egg and collect the sperm, fertilize it outside and now put it into my body. They give them some treatments before the IVF. If you have had ectopic pregnancy before, you have a higher chance of having it again. The more times you've had it before, the higher the risk of having it again. People that have had surgery before, maybe a cancer or a tumor, that you had to do a surgery to remove, it causes the weakness of that tube. Therefore, once the muscle is weak, the egg gets there where the surgery was done and doesn't move. Use of contraceptives. If you are the one that uses hormone impregnated IU device, intrauterine device, contraceptives that we put into the uterus that have hormones that can also cause ectopic pregnancy because the device stays in this part of the uterus. If the egg passes, if the sperm passes and fertilizes here, the hormones that have made this wall soft can also cause ectopic pregnancy. So you are saying, oh, I've used copper T or I've used IUCD, or I can't get pregnant. No. The device may fail, and pregnancy may even be ectopic in the tube. So anytime you are asking for a contraceptive device or you want to take contraceptive, discuss with your doctor. Understand all the possibilities, all the complications that can occur. If you smoke, you could be at risk of having ectopic pregnancy. Trust me, it's a real thing. Smoking cigarettes, taking contraceptives, especially without doctor's prescription, having previous tubal surgery, having urinary tract infections, sexually transmitted infections, pelvic inflammatory disease, infertility products could make you more at risk, could result in you having an ectopic pregnancy. One of the most common complications of an ectopic pregnancy is a ruptured ectopic pregnancy. So the way this pregnancy is, this baby is in the tube. If it goes bigger than a few weeks, it will burst the tube, spill into the abdomen where the intestines are. It can cause excruciating pain, and usually a surgical emergency. That is, we have to rush into the theater and quickly close that end. That means that tube becomes non-functional and the person is left with one tube. So how do you prevent it? How do you prevent ectopic pregnancy? For one, I've said it, improve your personal hygiene. Be careful who you have intercourse with. Avoid multiple sexual partners, because these risky behaviors can lead you to having sexually transmitted infections. From time to time, get screened for STIs. STIs are sexually transmitted infections. Gonorrhea, chlamydia, HIV/AIDS, even hepatitis. Use barrier method when having intercourse if you're not ready to get pregnant and if you're not sure of the person's health status. Have your partner also use a protective method. Reduce amount of emergency contraceptives you use. Remember, someone said she used an emergency contraceptives earlier on, I think yesterday, and the person said, oh, she has difficulty getting getting pregnant because the cycle has been tampered with. Ask questions about fertility medications. Don't just say, oh, they said this medication works for fertility, let me go and take it. Use your contraceptives with medical counsel, that is, see your doctor first. Show that your personal hygiene is top notch, so you are not thinking of urinary tract infections, and not just for you, also for your partner. Remember, I didn't say, oh, for only the women. No, for your partner, because it's as important. Your partner, you can go and get treated and get antibiotics and everything, and get it, and your partner still remains untreated, and partner still gives you the infection again. So make sure that you and your partner are treated for STIs and urinary tract infections. Make sure that you use barrier methods. If you have had ectopic pregnancies before, discuss with your doctor. Be quick to go and check. Oh, I've missed my period. The first thing you need to do is go to the hospital, do a pregnancy test and confirm. The next thing you need to do is do a scan. Let's locate where the pregnancy is located. So located it and it tells you, oh, it's in the uterus, and you're rest assured. If it's not in the uterus, you have to remove it. I'm sure I'm talking to mature minds here, so when I say remove it, you understand what I mean by remove it. If the pregnancy has not even damaged your uterus yet, or you've done the early scan, it told you no, it's not in the uterus, it's somewhere outside the uterus, you have to go remove it, because we know of a fact that pregnancy cannot survive to maturity. It will only cause you damage, cause you an emergency, can cost you your life. If you are smoking cigarettes and you are planning to get pregnant, it's time for you to quit it. It can affect or can increase your chances of having an ectopic pregnancy because of the chemical content of the cigarette. Can weaken your smooth muscles, the lining also of the fallopian tube. Remember, we talked about smoking causing the lining of the airway to change and then become cancerous. When we were talking about causes of cancer before, the same thing can happen to the lining of the fallopian tube. How do we diagnose? The person comes and says, oh doctor, I'm bleeding. Oh doctor, I've missed my period. Or I've done a pregnancy test. Or the person has not done a pregnancy test. Oh doctor, I missed my period. The first thing we say is like, look, go and do a test. Let's confirm that you're pregnant. The person does the test and confirms that she's pregnant. The next thing we want to do is, okay, when last did you miss your period? Oh, you're supposed to come last week. I didn't see it. Okay, that means you're about 5 weeks. Let's go and do a scan to locate where is the pregnancy. We put a scan on the woman's abdomen and we're checking. If you find the embryo sac, oh, this is good. Congratulations, your pregnancy is there. Go and register for your antenatal clinic. We'll see you next 2 weeks. If we can't find it in the uterus on the scan, we'll say, look, madam, we can't find your pregnancy in the uterus. Where is it? We start looking in the tubes. We start looking in the abdomen. We start looking around. Oh, madam, I see that your pregnancy test is positive, and we can see the pregnancy in the fallopian tube from the ultrasound. For early pregnancy, they might probably do a transvaginal ultrasound. What do I mean? The probe of the ultrasound will actually be put into the uterus through here. They just put a covering on the probe of the ultrasound and check. It's usually more sensitive to find a pregnancy that is not in the uterus. So it will tell us, oh, the pregnancy is here. The pregnancy is not in the normal place. We've checked the cavity is not there. It's probably up here or here. Oh, I found the pregnancy, but it's not here. It's outside the uterus. This is the point where we start talking about, oh, let's try to remove the pregnancy so that it doesn't cause an emergency. It doesn't damage other organs. The ovaries, for instance, if it's here. The other blood test you can do, because the woman is bleeding, you want to do full blood count. Oh, does the woman have anemia? You're not looking at any other thing causing abdominal pain. When we see that this woman has ectopic pregnancy, how do we manage it? What do we do? Remember, I said that depending on the location, an ectopic pregnancy has to be removed. That pregnancy has to be stopped. We have seen cases of people that actually had abdominal pregnancies, and these pregnancies grew up to the normal age. Abdominal pregnancies are pregnancies inside the muscle of the uterus. You've seen some few cases that this pregnancy is inside the muscle, not in the lining. So the placenta grows here and the baby grows big, and eventually the baby is born. Rarely. But see, the percentage of abdominal pregnancy is just 1%. Most of the time, you have it inside the tube. You can see 12%, you can see 2 to 3%, you can see 70% in the ampulla. So the tube comes from the ampulla, the fimbriae, the ampulla, the isthmus. If the sperm meets the egg here and it comes back, it will damage everything here, the ovaries, because of the placenta. Now, I said that we have done a scan. Now shows these pregnancies in the tube. The next thing you want to do is you can do a laparoscopic, a tube and a camera to go into the abdomen, into the tube, to go and see exactly where this pregnancy is. How big is it? How far has it affected the tube? We can see it. It's located on the left fallopian tube. It's bleeding mildly or it's bleeding severely. With that camera and the instrument, that pregnancy can be removed. So laparoscopic method, that is, I'm using my camera to look, can also be a way to treat. So we can just go there and remove. Apart from that, there are medications that will stop the pregnancy. So at that point, it's not something you want to wait. An ectopic pregnancy is that you give some medication that will stop the pregnancy, and the woman sometimes will go back to a normal state. We've seen, we've tested, we've seen, we've removed it. Remember, this woman is not still out of the blues. She can still have ectopic pregnancy again. That's why it is good to quickly go to the hospital, get examined, get investigated, so that you know, okay, this pregnancy that you said is positive, where is it located? I'll give you a scenario. I have a friend that entered the clinic. Doctor, I have abdominal pain. I'm just feeling pain. It's so terrible. I'm feeling terrible pain. And I asked her, are you bleeding? I didn't notice any bleeding. Since when have you had this abdominal pain? It just started today, this morning. When was the last time you saw your period? It's actually more than a month since I was supposed to see my period. Okay. So I'm thinking, number one, she's pregnant. Where are you having the pain? It's just all over. I'm having the pain all over my lower abdomen. In fact, it's causing me pain when I go to pee. When I stand up, I feel pain. When I sit down, I feel pain. When I try to lie down, the pain is unbearable. So I can't even stay in one position. I have to keep on moving around. I'm already thinking a ruptured ectopic pregnancy. That is, the ectopic pregnancy has burst open from the tube. Gloves. I examined this lady. The abdomen was tense, painful. Just light touching of the abdomen was very painful. In fact, she could not allow me continue with the examination. I had to say, okay, look, let's go and do a scan. Let's find out where this problem is coming from. Because when a woman tells you, oh, I'm having pain, or I missed my period, I'm thinking 70% of the time ectopic pregnancy. But I'm also thinking other things, like diverticulosis, like maybe a mass that is there, like uterine fibroid that has gone complicated, like endometriosis. I mentioned that before. That this person is bleeding in a pocket, but the bleeding is not coming out. This woman did a scan, and we could see that she had had an ectopic pregnancy that had ruptured. So it ruptured, and we could not see the uterus. We could not tell which part of the fallopian tube. We could not tell which part of the uterus. And I said, well, this is time for surgery. We have to do a surgery now, because it's an emergency. If you allow it to go far, this woman may bleed to death. A few minutes, I got the surgeon. Both of us went into the theater, put the woman under sedation. We opened. Lo and behold, the pregnancy had burst into the abdomen. The placenta had already formed. The placenta has formed and taken over all this space. Placenta has affected the uterus and entered the uterus. Placenta has affected some of the intestine. It has affected the ovaries. The placenta had gone all over back to the back of the uterus, to the other fallopian tube, and taken also that fallopian tube. And in that case, what do you do? Number one, we had to remove the fallopian tube on this side and the uterus on this side, which means the woman has lost her fertility on this side. So she only has one tube and one ovary on the other side. Because this tube was also affected, we had to remove part of the tube, which means this tube too is affected. So the chances of having babies again has been reduced further. All this could have been prevented if she had come in to check when she missed her period. If she had done an early scan to find out, okay, where is the problem? Where is the pregnancy? This lady is still in her 20s, already has a challenge of infertility by ectopic pregnancy. So someone has come, the person has missed period, pregnancy test is positive, you've done a scan, you've checked, and the person has ectopic pregnancy. You give medications first to make sure that you stop the pregnancy. You want to make sure that this pregnancy is not too big to cause complications. And if it's the one that comes and tells you, oh, I have a severe pain, and you check and it's already ruptured, it's surgery immediately. The person has to go to the theater. You have to remove as much blood. You have to remove the placenta. You have to make sure that this person is not bleeding. You have done your blood test to see how much blood the person has. Now, after the surgery, like in the case I just cited, counseling starts. Start telling the person, oh, this is what has happened. Fertility has reduced. This is one step. One step you need to do now is to don't beat down yourself. Don't feel sad that you've lost your tube. You are still very much able to have babies. The next time you miss your period, please come early, do early scans, and speak to your doctor. Prevent sexually transmitted infections by not having multiple sexual partners. Protect yourself with condoms and barrier methods. Also, improve on your personal hygiene. You are offering counseling, and for someone that probably it has affected the person completely now, the person has now become infertile, so to speak. You can always collect the eggs and do an in vitro fertilization for the person. That is, you fertilize the egg outside. When you're sure that it's fertilized, and you now put it into the uterus and watch the pregnancy. In some cases, ectopic pregnancy can make the woman faint. As a result of the pain, the severe pain, she can faint as a result of loss of blood. They tell you that she's pale, she's whitish. They tell you that she was having bleeding in her pregnancy. You can think, oh, this must be ectopic pregnancy. Quickly go to the hospital. Call your 911 or whatever emergency ambulance is. Get to the hospital. Fainting, severe abdominal pain, bleeding. Remember, all this occurs in someone that has confirmed that pregnancy is there. Questions: can a woman continue taking her prevention pills while on her period, or it doesn't matter? So your pills are designed in such a way that it allows for you to menstruate. How do I mean? The pills that you're talking about are usually arranged in such a way that you have 21 days of the pills and 7 days of iron. So when you look at your pregnancy, your monthly pills, your daily pills, you see it arranged 777. They even put an arrow. Day 1 to day 21, you use the pill. Then from day 22 to 28, they'll tell you iron. The color of the pills is a bit different, which means that on day 1, day 2, day 3, up to day 21, you're using the pills. On those remaining 7 days, they allow for the body to menstruate. After those 7 days, if you want to continue the pills, you start again with another pack. Day 1, day 2, day 3, up to day 21. So if you are menstruating already, it shows that you may not get pregnant, or you can't get pregnant during that period. So you may not need the pill. But once the menses have stopped, you have to start the pills again. Thank you so much.